Hi, I'm Radhya Raj, and it is Endometriosis Awareness Month. Now, there are 4 stages of endometriosis, but these are not indicative of the level of pain. For example, you can have stage 4 endometriosis, and a person that's got stage 1 endometriosis could be experiencing debilitating pain that stops their day-to-day activities, whereas you're managing your pain and you can go about day-to-day life like normal. When it comes to endometriosis, it being left untreated can have dire consequences. Endometriosis can progress rather rapidly, and it can affect every organ in your body. At the time that I was diagnosed, my ultrasound looked like I had multiple fibroids, and so it was proposed that a hysteroscope would be done to remove those. And while this is going on, I would have a little look-see about endometriosis, because it seemed like that was a high possibility. I came out of theatre a lot worse than one should be after a hysteroscope. And here's what had really been going on. So the endometriosis had formed a mass, and that had adhered itself to my abdominal wall. There was endometriosis on my bladder, it was on my uterus, it was also on my colon. And all of that needed to be scraped away. It was also necessary to sever 2 nerves. And so, coming out of surgery with the full extent of pain, because I don't take bowel to anesthetic, so anesthesia wasn't an option. Here's what I got to know. At 24, I would be in menopause. But at the same time, it was so incredibly validating to finally know that someone believed me, that I was not just being dramatic or having a low threshold for pain. No, it means not being able to eat. It means falling unconscious from the severity of pain, nausea and vomiting and all of that. There was a reason behind it, and that reason was endometriosis. It took multiple doctors and 12 years for me to get diagnosed. And my hope is that patients with endometriosis can get faster diagnosis, better treatment options, and have better outcomes. I don't think that's impossible to achieve.